David, Walt is one of the professors hit by the Trump funding freeze. The professor is part of Harvard's medical school and has lost hundreds of thousands of dollars in research grants. It follows months after he was awarded the National Medal of Technology and Innovation, the highest honor in his field. The professor joins me now from Massachusetts. Professor, so you've lost this grant money. Was it specifically lost in a sense, you were told you were losing it, or was it just a whole swathe of grants were withdrawn and yours was unfortunately one of them?
Well, Richard, I'm not quite sure how to answer that question because there's very little information. Last week, I received notice that my grant funding for a grant that's aimed at early diagnosis of ALS, also known as Lou Gehrig's disease, and was canceled for the second year. I'm presently in the first year of the grant, and that it would end effective June 30th. This morning, when I came to the office and opened my email, I was shocked to find that I had received notice from the Department of Health and Human Services that even this year's funding was canceled effective immediately. I have 3 people working on this project here at Harvard who I'll need to find other funds or simply stop working on the project.
That was going to be my next question, the effect of this. Let's look at the effect in terms of research. Try not to lose me with too much of the detail in terms of the technical detail, but the research that you're doing is designed to do what, and who will be the loser as a result of it not continuing?
Well, I think the big picture, before I get to my own specific research, is that cancellation of funding to researchers across the U.S. will delay medical progress and will threaten public health. There's no question about those outcomes. These cancellations will cost lives that could potentially have been saved in the future if the medical research was allowed to continue. Look, I'm not young, but I'm still doing research because I'm committed to helping patients. My lab specifically works on neurodegenerative diseases, cancer, infectious diseases that have the potential to enable early detection. They can help discover new drugs, and they can potentially lead to cures for these devastating diseases. And so if we can even solve one of these problems, right, it will benefit many, many patients. That's my motivation. And to take that opportunity away from me and other dedicated researchers, in my opinion, is a travesty.
When you are in the canteen and the cafeteria and in the staff dining rooms and bars, and you're talking to your fellow professors, your fellow faculty, and how damaging is this, firstly, to Harvard as an institution, and secondly, to, if you will, Research USA, capital R, capital U, capital SA, as a world-class home of innovation and research?
Yeah, I think that at least the effect on Harvard is to be determined. As I understand it, there's possibility of this going to the courts. I'm not involved in any of that, but I can answer the second part of your question. And I think these cancellations, I think one of the biggest effects is that they're going to affect young people who want to enter these STEM fields. Job hiring here is paused. Acceptances into graduate programs are being cut. And the future workforce in these fields of science and technology will not be here in the U.S. This is going to have devastating consequences on innovation, education, and the economy for years to come. The US, in my opinion, is ceding our science and technology leadership to China and to other countries.
Professor, we will check in with you again as this continues, because if we may, sir, and I'm grateful and honoured that you took time tonight to speak to us. Thank you for joining us, Professor. Thank you.